I'm Charles Ray Jones. I'm a physician in the practice of pediatric adolescent medicine with an entire practice devoted to tick-borne diseases as well as to pandas. I participate in the ILADS training program and have been doing so for many years. I became involved in the ILADS training program because the physicians, because the people organizing it thought that I could help train individuals who are in the medical world how to be involved in treating and diagnosing children with Lyme disease. And as I recall, I think I'm the only physician in the program who deals solely with children and adolescents. It's an excellent idea. When I first heard about it, I was thrilled that they asked me to be a part of it, and was eager to get involved and on board and having physicians and other medical professionals coming in and doing a preceptorship program. One little boy who came in from Lexington, Massachusetts as a 5-year-old, he's a 150 IQ. He was badly hit by Lyme. His IQ dropped to 100. He didn't care whether his eyes hurt, his head hurt. He didn't care about his joints hurting. He had fever and fatigue. He lost his mental head, and that bothered him a lot. And we told him he was fixable, that things would be okay. He was reassured, and he became totally fixed within a matter of a year and a half. And the last time he came in, he's a very sort of formal little kid. The IQ came back and all of his disease went away. And he came back and said that he did a survey of all the children in his town, a very affluent town in Massachusetts, who had Lyme disease. A survey of all the children in this affluent town who had Lyme disease. And he came to the following conclusion, that only smart children get Lyme disease. And why is that? Because spirochetes eat brain, and smart brain tastes better than dumb brain. The main thing is that the best way to train is in an office with the children here, the parents here, and in the setting of a disease to be fixed. And it's very complex. But in a way, it's complex but very simple. But I think it's more simple now in terms of understanding it and being able to offer solutions than it was, say, 10, 20 years ago. But that may be my delusion. But it's certainly getting a lot done. I think the only way a person can really learn about Lyme disease, the best way to learn about tick-borne disease is to be faced with the patient with the tick-borne disease. I would encourage anyone to contribute to it. It's an absolutely essential program to have. Nothing takes the place of a one-on-one contact with two healthcare professionals in the setting of dealing with the clinical setting of dealing with the patient, especially the children. The people who come here like it, and they say they glean satisfaction from it, and they're also intrigued at how easy the flow is and how things can get done without being traumatic. And only at the end do we have people go up on the table, and some of the kids refuse, and that's okay. You can stand up, do a stand-up examination. Isn't that, how long does it take to go over, do a lot of a little kid this big? But the training program, I can't speak too highly for it, and encourage people to continue contributing to it so that physicians can be trained. One can go to conferences and learn, but that's different from learning one-on-one here. And I feel it's important to train someone to pass a legacy to be able to manage a program with involving children and tick-borne diseases. And it's a lot of gratification in doing it, and it's great to see the child who comes in who's very, 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 very sick, and then over a period of months to sometimes years to see them get totally, totally better and be totally fixed and be able to be whole again. I would encourage physicians and medical healthcare professionals to get involved with this program. One of the problems in care of not just children but adults with Lyme and other tick-borne diseases is availability of appropriate care, and I feel that it's that I have an obligation to see as many children as I possibly can, and to enable them to have the proper care and evaluation, and also to enable other physicians and healthcare professionals to be involved in their care. There's a statement on the wall in the waiting room that is as follows: 100 years, it won't make any difference what kind of car you drove, what kind of house you lived in, how much money you earned, where you vacation. But the world will be a different place because you were important in the life of a child. That's always comes to mind. I always try to remember that. I encourage people to get in become aware of it and get more information and register on ILAD.org.